Kumar, voice therapist, and today we are live, and today we are after treatment live, and today date is 8th of May 2025, and in fact we did pre-treatment live on 1st of May 2025. So the guy who you'll be seeing in this live pre-post, these are the people. One is has come from the Singapore, but basically he is from Malaysia, and one is from India, and they are having a different voice problem, and you will be listening pre and post treatment voice during this live. And the topic what we are going to cover in this live will be first will be introduction about me, then our center, our YouTube channel, and you will be listening the patient's voice before treatment who came on 1st May 2025. And next will be what are the information required before starting speech therapy or voice therapy. And one more thing I am going to add here on the pre-treatment live that we did on 1st May 2025, we have given answer of many questions. Those questions I am going to repeat again. So I will not be giving answer and repeating again the answer. So my small request is, please refer our pre-treatment live also that we have done on 1st May 2025. So let's go forward. So next will be the types of service we provide, then high pitch voice, sign, symptom, cause and treatment, stammering, sign, symptom, cause and treatment. Are there any side effect of voice therapy or self-treatment? How to contact us? What do we do in voice therapy? Do we offer accommodation facilities at our center? Which treatment is preferred first, voice therapy or surgery for pitch correction? Do we have any branch of our center till now? And next will be cost and duration of treatment for voice and speech disorders. Then I'll be talking on how do we treat international patient, online or offline. Next will be, is saying 1, 2, 3 or saying in your voices stage of treatment or the end of the treatment. Next is are the result of voice therapy permanent? Next is the effect of food and drink on the voice. And there will be announcement of next batch of group therapy that I am doing now only. Our next batch of group therapy is going to be started on 15th of May 2025. So this is a small announcement. And next will be who are the ideal candidate for voice therapy. Next is all high pitch voice or female voice is Puberphonia. And next is online facilities for communication disorders at our center. And then I'll be talking on tips. I'll be giving few tips for maintaining healthy voice. And after that I'll be talking on why puberphonia should be treated as early as possible by speech-language pathologist specialized or expert in voice disorders. Next is why do patients need to visit our center physically for certain communication disorders? And then I'll be replying the question from the live chat. So one by one we'll be moving forward. So first is introduction about me. My name is Sanjay Kumar. By profession I'm a speech-language pathologist and audiologist, and I have studied from AIIMS Delhi. From AIIMS New Delhi I did my bachelor in the speech and hearing science. And my bachelor degree name is Bachelor of Science Honors in Speech and Hearing, and I did my master from University of Mysore. My master degree name is Master of Science in Speech-Language Pathology. So at our center we do hearing evaluation, hearing dispensing also apart from the voice therapy, and my passion is treating voice disorder. So this is a small introduction about me. And next is our center. Our center name is Sanjay Speech Hearing and Rehabilitation Center, and we started our center in the year 2010. And from then onward, the success stories of the patient, we are creating hope across the globe. And our client list include people across the globe. So दुनिया का कोई भी ऐसा महादेश छूटा नहीं है जहाँ से लोग हमारे सेंटर से सर्विस नहीं लिए हैं अब तक. So this is small introduction about our center, and we don't have any branch till now. Our center is the only one that is located in Bangalore only. And next is our YouTube channel. So we started our YouTube channel in the year 2010, and from last 15 years non-stop with the success stories of the patient, with the help of our YouTube channel, we are creating hope across the globe. So I was telling our client list include people across the globe. So if you just watch in the home page 35 minutes video, the first video you will find this small boy, and this boy was having some dysphonia, and his father is from USA and he is a rheumatologist. His mom is an anatomic pathologist, and they were working in the hospital. In spite of working in the USA in some hospital, they have shown faith on us and they took treatment from us, and of course the voice change was quite impressive. His father himself is telling in this video. Next patient is from Russia. So America हो गया, रूस भी हो गया. So he was having vocal cord paralysis and dysphonia, and we gave online voice therapy, and the change was again quite impressive. And if you move forward slightly, so this guy came from the London, so now it's a Europe. And if you move forward slightly more, I think yeah, this guy is again from Malaysia, and if you go forward slightly, and it was very interesting case, and he came from for the functional aphonia. It's a very rare kind of voice disorder from Africa, and he tried many places and they came from the Africa. तो आप देख सकते हैं कि people coming from USA, from Russia, Europe, Africa, so all over the continent people are coming here to take our services. So this is just for the awareness, like kind of passion we have for the communication disorder and how we are creating hope across the globe. So you share this kind of video, so you can also create hope across among the patient facing some voice problem, and they are interested in the non-surgical management. So I'll be calling now my patient, and who came on 1st May, and the name is Segran. Actually he came from the Singapore, and he is basically from Malaysia. So Segran, we are live at our YouTube channel. So hi Segran.
Hi.
So what was the problem, why you came, and how do you feel now? What are the reactions you are getting from your family members and the friends?
Hi all, my name is Segran. I came from Malaysia. I work basically from...
You came from Singapore, no?
Singapore, yeah.
Yeah, from Malaysia you are basically, okay.
Yeah, I came from Singapore. So I came here due to my voice having a childish when I talk over the phone.
Mm-hmm.
So I came here to treat that. So now after the treatment, when I call my home, they hardly believe my voice. They thought someone else is talking. So there is a lot of changes in my voice right now.
Okay, and have you compared your voice sample on the first day and today in your mobile, and what difference you observed?
I completely impressed on my voice itself, because there is a huge changes on the first day and 8th day itself, doctor. Yeah.
Okay, so let's see. I'll be playing your pre and post videos also. So I'm just turning the camera, and so that we can watch your pre and post video. So this was your first day voice sample recorded on 1st May 2005. His name is Segran, and completely high pitch voice, and today is 1st May 2025. Segran, from where you came? Why you came?
Hi, my name is Segran. I came from Malaysia all the way to see doctor. I came here because I want to correct my high pitch voice.
And today we are taking voice sample before treatment.
Yes.
Mm-hmm. So what are the challenges you are facing in your day-to-day life communication?
Okay. Usually when I communicate through phone call, people hardly recognize my voice as male voice. That is the main reason I want to correct. And then when correct the voice, I feel I have more confidence in giving speech.
Okay, so you are telling your voice look like a feminine voice and confidence is lacking. To improve the voice quality and the confidence you have come. Thank you. Thanks for coming. We'll do the needful. And now I'm going to play after treatment voice sample. Post-therapy video of Segran, and today date is 8th of May 2025. Segran, I want speech sample after the treatment. What was the problem, and why you came, and how do you feel after the end of the treatment, and from where you came?
Hello doctor, my name is Segran. I came from Malaysia. I work in Singapore. So I came here for my high pitch voice treatment. Usually when I talk over the phone, a lot of people are commenting that I have female voice. I came here to correct the voice. However, after the treatment, I feel like my voice has been improved. When I call my friends, they say that my voice has been changed.
And you have recorded your mobile also. So first day sample and today's sample, what changes were there?
there is a huge difference in my voice, and I feel very happy about it on the treatment that I got.
So you came here from Malaysia or he came here from Singapore?
My native is Malaysia. I work in Singapore, so I flew from Singapore to Bangalore here.
So this was the voice of Segran, and those who are watching this live, if you are able to see positive changes, please like this video, share this video, so that people having similar problem can get hope, motivation, and they can reach to right. Segran slightly come this side. Yeah. So any message you want to give those who are watching this live?
I strongly recommend you guys to take treatment with Dr. Sanjay, because he's very experienced and he guide me from stretch how to improve my quality of voice from the day one. He have guided me along so that I can achieve my voice today.
Okay, thank you so much for recommending our center. And next patient I will be calling Vishwanath. Yeah. So actually he was he became late because of some personal reason, and yeah, please come here. So we are not able to do pre-treatment live, but in the post-treatment live is available. So yeah, so tell us, what was the problem? What was the ENT finding? Why you came, and what do you feel after this therapy?
I was having a high pitch voice, so to correct that I came to this center. Even I came to know about this center through the shorts. So yeah, that's how I ended up coming
And
here.
what was your ENT finding? I think because of that only delayed. I sent for laryngoscopy. When I did my acoustic analysis, I thought it's better to go for history, based on the history for laryngoscopy. I don't suggest all the patient for laryngoscopy, but in your case I sent. And what was the finding?
So there is a gap in the vocals, right? So
vocal cords.
Vocal cord. So I think that's what we figure it out.
And technically the problem was
Sulcus.
Sulcus vocalist grade
Sulcus was grade 1. So I had a minute grade 1. So yeah, I think that report helped us while treating as well. So
yes.
Yeah.
So I want to tell the people, those who are watching this live, we do like perceptual evaluation. Sometimes we suggest during phone call only you need to go for laryngoscopy when the patient call, and sometimes we don't get idea during the phone call. So once they come to the clinic, when we do our evaluation, laryngeal like acoustic analysis, and when we do some trial therapy, we understand that okay, this patient requires some kind of laryngoscopy. And some patient just after listening on the phone only decide he don't require something like that. So this is the way how we manage our patient. So when he came on the 1st May, we thought laryngoscopy is important. So we sent for laryngoscopy. By the time you came, live was finished.
Yes.
So we started your treatment one day late. So that's why I was not able to show.
No
so one more thing. Like first day you recorded your voice sample, and now even you are talking to the people, what changes you are observing?
Definitely there is a slight change. Definitely we have observed it, because as you mentioned, right, I slightly joined little late, so in results has to reveal yet in next coming days. But yeah,
just consider this is the final. Based on that,
even on that front, I can say that there is a improvement in the bass voice. So the voice which I am trying to achieve, right, so from the day 1 to now, there's definitely a great improvement. So yeah,
okay, let's see that what you are telling and what we have achieved, both are same or different. So this video will be helping us to understand. And those who are watching this video, please write in the comment box what is your observation. Please watch carefully. If possible, use your like headphone or earphone. So this is a pre-treatment voice sample.
His name Parameshwar, age is 38 years, and today date is 2nd May 2025, and complaint of high pitch voice from last 10 years, and the ENT finding is grade 1 sulcus and linear phonatory gap. Parameshwar, I want speech sample before treatment. Say about yourself, why you came here.
Yeah, I'm Parameshwar. I came here for my high pitch voice issue, so looking forward for the treatment and get a deeper voice if possible.
Day-to-day life because of the voice problem?
I mean, not exactly, but myself, I feel like when I hear my own.
So now after treatment,
better, and voice getting little deeper and deeper.
On which date you came and what date is today?
I came on 2nd, and today is I think 8th May.
May 2025. And tell your hobbies. How you spend your time on Sunday?
I mostly, as I mentioned, I spend my day on digital marketing stuff online. So mostly browsing internet and finding the new ways to promote.
So those who are watching this video, if you are able to see the positive changes, please like this video, share this video, so that people, those who are having phonatory gap, sulcus, vocalist, they also can get some hope, motivation. Although it's very challenging, but I appreciate Parmeshwar's motivation, because I told very frankly, very clearly, like it is going to be challenging, and he was following our instruction, and we are at this stage.
Yeah.
So any message, Parmeshwar, you want to give to the Vishwanath, no? Not
Vishwanath Parmeshwar, so
Achha,
you can
both
call
are correct,
both, yeah, both are correct.
Okay, so any message you want to give to those who are having sulcus, vocalist and phonatory gap?
Definitely you can try for this before going for any surgery and all, because when that is the ultimate way of changing your voice naturally. I think I highly recommend to come and try this if you are facing any sort of voice issues.
Where they should come?
Sanjay's
SLP Sanjay Kumar.
Yeah. So
because what I have seen, that the awareness is very less. When the pitch is higher, the people will think it's a puberphonia. High pitch, even I have seen the muscle tension dysphonia, sulcus vocalis, phonatory gap, vocal cord paralysis, and I have studied in rare case it can be hormonal issues also. So like fever is a kind of symptom.
Yeah.
For physician.
Yes.
For us also, high pitch is a kind of symptom. All high pitch voice are not puberphonia. So many healthcare packs will be giving some exercise on the some YouTubers. So be aware, like wrong vocal exercise, wrong way of doing vocal exercise, or right vocal exercise but doing wrong way may damage your voice and vocal cord, and sometime permanently, and people like me also not able to help you. So when you go to petrol pump to buy the petrol, just you try to find out who is the best person, best petrol pump who is providing the best quality of petrol. So when your matter comes for your health or voice, I think you can't give your voice and the vocal cord to any illiterate on YouTuber or technician.
Yeah.
And I always inform what are the difference between certified speech language pathologist and like a speech and hearing technician or healthcare quacks. So please refer the pre-treatment live, and in that I have spoken in very detail, and the link of the pre-treatment live we are going to give in this live stream. So please don't forget to watch to know how do you know who are the speech language pathologists and who are the healthcare quacks, to understand. So thank you so much.
Thank you. Thank you.
I'll be continuing this live. Please have a seat. And thank you all for joining us and watching us. And now I'll be going one by one. And already I have told there are so many questions, and we have answered in the pre-treatment lives. I'm not going to repeat those answer. And few things I'll be telling, and one thing is announcement of next batch of group therapy. So that we are going to start on 15th May 2025. Next batch will be starting, and if any questions will be there from the live chat, I'll be answering now because I'm now free. And if there will be no question, then I'll be answering few questions those who ask frequently at our social media pages. So if anybody is watching and if you have any question, you can answer, you can ask. So most common question at our YouTube channel comment box is, sir, how do you contact to you? How we contact you? So our contact details are in the description of this live stream. So it's very easy to contact us. And the one more common question will be in Hindi, people will ask, sir, kharcha kitna aayega? How much will be the cost and duration of treatment? So for that, we suggest the patient to please call us. We'll do the perceptual evaluation. If needed, we suggest certain tests like stroboscopy and or laryngoscopy. And after that, we comment on the treatment cost, expected outcome, duration, etc. So these are the very common question. And the one thing I want to share here, how to keep your voice healthy for longer duration. So I'm going to tell you some vocal hygiene tips. To keep your voice healthy, drink plenty of water. Water is a very good lubricant. So if you are 10 to 15 glass of water, if you are drinking in one day, it is a very good idea. Avoid frequent throat clearing. Bar aise nahi karna hai. If you are doing frequent throat clearing, there will be a lot of friction between the vocal cords, and the voice and vocal cord may damage. Avoid smoking. Smoking may result into the vocal cord polyp. Smoking is a kind of vocal abuse. avoid shouting. When you are shouting, that is also kind of vocal abuse. And it was very interesting recently in our Google review, one person wrote like, sir, means I don't think he is an actual patient. He wrote like, here we ask the patient to shout. So I am telling you, shouting is a kind of vocal abuse, and we don't suggest any of our patient for shouting. So I don't know who was that, and sometimes competitors and the healthcare quack also to just spoil our names do this activity because I expose the healthcare quacks. So I just want to tell all the exercise we suggest to the patients are very comfort way, and we don't ask the patient to shouting. And how can somebody write in our Google review we suggest shouting as a vocal exercise? So that may be healthcare quacks, and he want to just spoil our name. But I can say that when I started this life, I have shown that first patient who was from USA, and his father is doctor, mother is doctor, working in a hospital. In spite of that, they are showing faith in Indian speech language pathologists. Next is from the Russia. They are very advanced in technology, like people say USA, Russia, and even the UK. They are coming and they are taking treatment either online or offline. So I think those kind of healthcare quacks can't spoil the name. I think I'm very confident. So again, I will be repeating. Shouting is a vocal abuse. It's not a vocal exercise. Anyone, either any YouTuber, healthcare quacks is suggesting to shout you, be aware that may damage your voice and vocal cords sometime permanently. So I was talking about the vocal hygiene, and avoid very cold thing. If you are taking very cold thing, because vocal cord is a kind of muscle, so if muscle will be exposed to very cold thing, then what will happen, the natural shape and size will not be there, so that will affect your voice quality. So if you want to maintain your voice for long time, and if you are a professional voice user also, don't take very cold thing, especially ice cream and the cold drink, you should avoid. And if you have any voice problem for more than 2 weeks, meet to a certified speech language pathologist and discuss your problem, or you can meet to the laryngologist to understand the problem in detail. And avoid whispering when you talk like this, my name is Sanjay Kumar. So this will create more friction in the vocal cord, more stress in the, I can say more stress on the vocal cord. So avoid whispering. Whispering is a kind of vocal abuse. तो एक बड़ा ही इंटरेस्टिंग कहानी मुझे याद है. एक पेशेंट आया था गदग, दैट इज़ वन प्लेस इन कर्नाटका, एंड he was having some throat infection, and after the throat infection he met to an ENT doctor, and ENT doctor suggested some medicine, and at the same time he suggested to take some voice rest, and he misunderstood the instruction, and what he did, instead of voice rest, he was whispering for, and the session was I think for 4 weeks or 5 weeks something, so 4 to 5 weeks just he was whispering, and after this 4 or 5 weeks whispering was remaining, and he developed a very rare and very challenging problem called spasmodic dysphonia. So we went to all the kind of professionals who were existing healthcare professional, and finally he came to us, and that was beginning of my career. If you'll go to the oldest video, I think that will be in 2010, from 15 years we are pre-post videos we are creating hope across the globe. So if you find oldest video, I think his name was Lappa, something like that, you will find that is spasmodic dysphonia patient. So how the vocal abuse can spoil your vocal cords. So he did just whispering, and whispering is a kind of vocal abuse. So don't whisper, don't do smoking, don't shout. If you are a teacher and classroom is big, ask your management to provide the amplification device, and in that way you can maintain your voice for longer duration, and drink plenty of water, avoid very cold things. So this is the summary for vocal hygiene and how to keep your voice healthy. Even you can watch our shorts. I have made one short through few tips to keep your voice healthy. And next is why puberphonia should be treated as early as possible by speech language pathologist expert in voice disorder. So like during puberty, vocal cord mass length got changed, and the vocal cord is ready to produce the low pitch voice, and still you are using high pitch voice. Suppose this is my natural voice, and if I'm knowingly producing this high pitch voice like my name is Sanjay Kumar, I'm a speech pathologist. If I'm doing such kind of voice, I'm creating a stress on the vocal cord. So it is again a kind of vocal abuse, and if I'm doing vocal abuse, that may damage voice and vocal cord. Sometime vocal abuse may result into the muscle tension dysphonia, phonatory gap, sulcus vocalis, and that condition will be very challenging to treat. So if you have puberphonia, take treatment on the right time from a certified speech language pathologist expert in voice disorder, because all the speech language pathologists will be not be expert in the voice disorder, because speech language pathology field is very broad. Few speech language pathologists will be expert in delayed speech and language, others will be more expert in swallowing disorder called dysphagia, few will be more expert in neurogenic communication disorder like dysarthria, aphasia, few will be more prominent or more expert in fluency disorder, few will be more in articulation disorder. For people like me are expert in the voice disorder. So you have seen that people are coming from like London to our center. So do you think in the London there is no speech language pathologist and he has not tried? He must have tried. The person to whom he has met that patient may be the expert in some delayed speech and language, and he went for the voice therapy and didn't work. So when you are going to take the voice therapy, the person should be expert in the voice disorder. And because I studied in AIIMS Delhi, and there we have a lot of patients, n number of patients, and I developed my interest in the voice disorder. So there was no problem with the patient. I was having a passion in the voice disorder, so I developed more skill. And when I did my master in the University of Mysore, so that practical experience was combined with the theoretical knowledge. So in that way, and most important is my passion. And now I have 15 years of experience as working in my clinic, and apart from my clinical knowledge at AIIMS Delhi and University of Mysore. So this is the main reason. So you should find expert who are really expert in the voice disorder when you are going to take voice therapy services. And now the next question is replying question from the live chat. So if I'm seeing if any questions are there, I'll be answering. And one person is asking some question. Prakash is saying what to do if we are facing sulcus vocalis. So first of all, you have just mentioned sulcus vocalis. We don't know what kind of sulcus vocalis. It's a grade 1 or grade 2. So we have seen in some patients of sulcus vocalis some improvement by the voice therapy. If you explore our YouTube channel playlist, you will find the sulcus vocalis playlist also. And even today's one patient was having sulcus vocalis. So you may try voice therapy from the people who are really expert in the voice disorder, not like a healthcare quacks and not any speech language pathologist. I'm especially telling who are expert in the voice disorder. And I have read in my textbook like if voice therapy doesn't work, then you should discuss with the surgeon. So that answer will be given more detail by the surgeon. But but I can't suggest you should go for surgery or not. But I am expert in the voice therapy. Then I can suggest first you should try voice therapy. And Saurav Bunia is saying Kolkata address mein treatment hoga. So Saurav, our center is in Bangalore, and we don't have any branch till now. So please refer the description of this video, and then we'll guide you in a more effective manner. And you can call us also. We'll try to listen your voice. Next is Utkarsh is saying, sir, you too must have cleared the NEET exam only by you, and you have been able to get admission in AIIMS Delhi. I think I'm not understanding what you are asking. If you are thinking about my course related to speech and hearing, AIIMS has closed this course. I was the second last batch. I did my bachelor in 2004, and one more juniors came in 2005. The reason was that the AIIMS was finding difficulty to maintain the course. All the faculty were moving to abroad for better career opportunity. So because AIIMS is a big institute, they have different kind of courses. So now the AIIMS is not running this course. And so thank you all for joining us and watching us. Thank you so much. And if any question you have, you can write in the comment box. We'll try to give answer in the next live, or maybe we'll reply in the live. Okay, thank you so much for joining us and watching us. And once I'll be showing the patients, those who have come for different communication disorder at our center. And one very common question will be, the people will ask me, after treatment, is there any relapse? So there are two kind of communication disorder. In that case, I have seen the relapse at our center. One is the stammering, other is the spasmodic dysphonia. So in this life, no one was having a spasmodic dysphonia, and in this life, no one was having the stammering. But apart from that, other communication disorder, we have seen that once we treated, what patient achieved, it was stable. Till now, what experience we have. So, but health science is science of exception. So in future, what will happen, time will give the answer. So I'll be showing once those patient who has come from different places, and I'll be showing to them before stopping this live. And yeah, and you can keep checking our YouTube channel post. We'll be updating some new information, and this is our YouTube channel post. I'm just turning the camera. So this is our YouTube channel post page, and here we update new information. So you can just, for updating knowledge about our work and any announcement of any new batch of group therapy, you will be getting information from here. So this is our like YouTube channels post page, and yeah, so you can just keep exploring. And I'm just turning the camera towards the patient who has come for, yeah, you can. So these are the patient, actual number of patients, yeah, I forgot to tell, many more, but few are not comfortable with the video. So our clinic protocol is there, we do live with only those patients, those who will allow the video, they are comfortable with the live or video, so we don't force. Okay, thank you all for joining us and watching us. Thank you all, love you all.